Good day, everyone. So, for this discussion, I will tackle one bioethical issue, which is the contraception. So, particularly here in the Philippines, the contraception has been clouded with debate between two groups that include the religious sector and liberal thinkers. And this topic will present the various methods and devices for contraception and the reasons why some people use them, and also the stand of Catholic Church on the morality of using any form of contraception. So let's define first contraception. So what is contraception? So contraception is a method or act of preventing fertilization of a female's egg cell inside a woman's body before and during sexual intercourse. So that means contraception can be categorized as before or during sexual intercourse. So it can also be in the form of condoms and spermicides, contraceptive pills, withdrawal method or coitus interruptus, IUD or intrauterine device, and then the calendar or the rhythm method. So regardless of what contraceptive device is used, the objective of contraception is the same, and that is to prevent contraception in the female's womb, or simply to prevent pregnancy. Also, this one, it shows us the different pictures of contraception methods. So the most common here, we have the male and female condoms, also the oral contraceptive pills. This one also, the hormonal ring or vaginal ring. So it's a hormonal birth control device for women, and it's like a flexible plastic ring. Usually it's latex free, that is inserted into the vagina of a woman, and it contains hormones estrogen and progesterone. So estrogen and progesterone. So these hormones are released over a 3-week period. So that means a woman will wear this vaginal ring for 3 weeks inside her vagina and then remove it, allowing menstruation to occur, and then insert a new ring after a week. So that means this prevents pregnancy by releasing hormones into the woman's body. And these hormones will suppress ovulation. So that means the ovaries will not release eggs. So fertilization will not happen. And aside from suppression of ovulation, this hormonal or vaginal ring can also thicken the cervical mucus to keep the sperm from reaching the egg cell. And also, it could thin the lining of the uterus or the endometrium. So it could thin the endometrium, of course, to prevent the implantation of a fertilized egg. So that's for hormonal ring. And also, we have here the IUD or intrauterine device. So I will discuss that one later. Also, we have these injectables, the contraceptive injection, and then hormones are injected to a woman in order for her to not be pregnant. And then we have surgical sterilization methods. So in women, it could be in the form of ligation, and in men, it could be in the form of vasectomy. Also implants, and then withdrawal method or the coitus interruptus, calendar or rhythm method. Also, we have here the vaginal douche. So when we say douching, it's the washing or cleaning out the inside of the vagina with water or other mixtures of fluids. So as what I have mentioned earlier, there is a debate between the two groups, the religious sectors and also the liberal thinker, of the uses of these contraceptive methods, because for the church, for them, it's against the law of God, and of course for some other reasons. And usually this douche or this um, vaginal douche is sold in the market in the form of hygiene kit. But there is a claim that some of them would contain spermicides or other chemicals that would kill or that will destroy the sperm cell, so no ovulation will happen during sexual intercourse. Next one, we have the contraceptive patch. So this contraceptive patch, it's a transdermal patch which is applied to the skin. So it would stick to the skin either on the arm, at the back, or on the lower belly or other places in the body. And just like the vaginal ring or the hormonal ring, this contraceptive patch would also release synthetic estrogen and sometimes progestogen hormones. Also, that's to prevent pregnancy. And another one, we have here the diaphragm or the cup. So this is a barrier method of contraception for women. So as what you can see here in the illustration, it's like a shallow dome. So it's in the form of silicone usually. So it has a firm and flexible rim. So this one. And this diaphragm, just like the hormonal ring, is also inserted in the vagina. So it's like a tampon so that it covers the cervix. So this diaphragm would cover the cervix and it would tuck in behind the pubic bone to stop the sperm from entering. And it's held in the position by the pelvic muscles. So those are the different contraception methods. So again, as mentioned, contraception can happen before and during a sexual act. So it's prior to or during the sexual intercourse. So different devices for contraception can be grouped according to these two types. So prior and during. So before sexual intercourse, we have the calendar method, the contraceptive pills, the IUDs, and other methods mentioned previously. And also for during the sexual intercourse, we have the condoms, the spermicide, and the withdrawal method again, which is the coitus interruptus. Now, let's take a look at the calendar method. So this one is considered a traditional method for family planning. And sometimes it is referred to under the category of natural family planning. So this is otherwise known as the rhythm method or the calendar rhythm method or the standard days method. And this involves the monitoring of the menstrual cycle of a woman, and it mainly concerns women who experience a regular flow of menstruation. So that is 28 plus minus 3 days. So that means it's 25 to 31 days. Or other references, it would tell us 26 to 32 days. And this method allows the safe period of 5 days before and after the menstrual period. So that means a married couple could do the sexual act 5 days before and 5 days after the period. And since this only involves the monitoring of the days of cycle, we can say that this is natural, this is also cost effective, and does not require any intake of medication. However, it may require skill in keeping track of time since it is based on the regular flow of a female's menstrual cycle. So one of the methods that is used is monitoring the shortest day of cycle and the longest days of cycle, just like in the example. So the shortest cycle will be deducted with 19 and the longest cycle minus 10. So example, the shortest cycle is 27, so minus 19, that would give us 8. And then the longest cycle is 29 minus 10, that would give us 19. So from 8 to 19 days, this one, 8 to 19 days, that will be considered as the unsafe period. So that means the married couple should not do the sexual intercourse in these days. However, the blue days are the days of bleeding here, and all other than red are safe period. So that's for the standard days method. And also, to easily keep track and to easily remember this method, the standard days method, a woman can use memory aids like marking the calendar or other memory aids such as the cycle beads. So again, I would like to emphasize that these standard days method are only used for or are only intended for women who have regular cycle. Again, that's 26 to 32 days long. And if the woman has more than two longer or shorter cycles within a year, the standard days method will be less effective and she may want to choose another method. So going back to this cycle beads. So this one, a woman can wear this color-coded string of beads that indicates fertile and non-fertile days of cycle. So what's happening here is that on day one, so that's the first day of monthly bleeding, the woman will put the rubber ring to the red bead. So red bead, first day of the period. And the next day, move the ring to the next bead. So the woman will move the ring here, and she will do this every day, even in bleeding days. How about for these white beads? So the white beads are days when the woman can become pregnant. So she should avoid unprotected sex during these days. For brown beads here, pregnancy is very unlikely. So those are the days when pregnancy is unlikely and she can have unprotected sex. And then, if the monthly bleeding begins again before reaching this dark brown bead, so the menstrual cycle of a woman is shorter than 26 days. So that's the indication of dark brown bead. So it would tell the woman if her cycle is shorter than 26 days. But if monthly bleeding does not begin before reaching the last brown bead, the menstrual cycle is longer than 32 days. So that's for the cycle days as related to the calendar method. Next one, we have the contraceptive pills. So these pills are medications taken by women who engage in sexual acts. So it should be noted, however, that the effect of a pill is not achieved by taking a single pill only, but by following a prescribed dosage for a specified time. And these contraceptive pills work by suppressing the cycle of ovulation. And some pills may also thicken the lining of the cervical mucus, making it hard for the sperms to penetrate the region. For the side effects, so you have nausea, vomiting, also headache, hypertension, impaired vision, stroke, heart attack. Another one is the IUD or intrauterine device. So this is a T-shaped device inserted inside the uterus. So that's for up to 10 years. And of course, that's to prevent the entry of sperms, which leads to the fertilization of egg cells. And IUDs sometimes contain medications to enhance the contraceptive action. So based on the picture, it can be a molded plastic device or it may contain copper. And these IUDs are particularly suitable for women who often miss pills or those who want to have long-lasting birth control. Also, this could have a side effect. So the side effects include bleeding, cramping, and uterine infection. Also, we have this picture. So this shows the schematic of the copper coil within the uterus. So this one. And another one, we have here the image of visible IUD strings on the speculum examination. So it's the healthcare provider that inserts this IUD to the vagina towards the uterus of a woman. And also, the strings have two purposes. So number one, it lets the provider or the woman check that the IUD stays properly in the position. And also, they are used to pull the IUD out of the uterus when it is time to remove it. And again, this must only be done by the healthcare provider. Next, condoms. So, condoms are usually made of latex. So, it's a rubber sheath worn over an erect penis. So, women or men can buy this one over the counter or in convenience stores. And this is considered among the cheapest way of contraception. And the main function of condom is to trap the semen, of course, that contains sperms once it is ejaculated from the penis. And also, some condoms may include spermicides to ensure that no viable sperms are introduced into the vagina that may cause fertilization. And also, for a time, the Philippine government, through the advocacy of the Department of Health, promoted the use of condoms not only as a tool for family planning, but also protection against sexually transmitted diseases such as hepatitis B and human immunodeficiency virus, and also other STDs. So spermicides, how about this one? So spermicides are chemicals that are placed in the opening of the vagina and are in the form of creams, jellies, or foam tablets. So the mechanism of spermicides involves the total killing of sperms upon their introduction to the vagina. And in some instances, some are able to swim across the vagina, fertilizing the egg cell. And once that happens, the effects of spermicides may cause congenital disorders to the fetus, such as malignancies and other body disfiguration. So that's one of the adverse effects of using spermicides. In the event that the sperm has able to fertilize the egg cells even with the use of these spermicides. So these spermicides again, so this is a birth control. So this is specifically a non-hormonal birth control method, but it uses chemicals that prevent the sperm from reaching an egg after sex. And if spermicide is used, it is applied before each and every time a sexual act is done. So it's also another barrier method of contraception like condoms or diaphragm. And also, we have here how to use the spermicide. So the applicator tube is filled with spermicide. So again, it could be in the form of foam, cream, or jelly. So it comes with an applicator tube, and the applicator tube is filled as indicated on the packaging. So this amount will vary between different spermicide products. And also, if um, the foam spermicide is used, usually the container is shaken, okay, before squeezing the product out into the applicator tube. So that's how you would fill the applicator tube. And then next one, a woman must get into a comfortable position to insert the spermicide. And in order to be effective, the spermicides will need to be inserted deep into the vagina near the cervix. And of course, the position will depend entirely on a woman's personal preference. So lying on the back for an instance may make it easier to insert the spermicide comfortably, and alternatively, standing with one foot on a chair, just like in this picture, or squatting may also be done. And then, the tube is inserted into the vagina, and the product is pushed out of the tube. So gently insert the applicator tube into the vagina as deep as it will go. And once it is inserted, slowly press down on the plunger part of the applicator stick or the applicator, this one, to release the product. And this should position the spermicide near the entrance of the cervix. And of course, this applicator must be washed or discarded after use. Next one, spermicides can be applied also to the finger as an alternative to using the applicator. And this is because the applicator provided by the manufacturer may not be comfortable for everyone to use. So what the woman needs to do is she has to squeeze the product out onto the finger and insert it into the vagina. And however, she has to take note that the correct amount is used, just like in the applicator. And then also, the spermicides can be applied directly to the diaphragm. And then once the spermicide is already in the diaphragm is folded in half and inserted into the vagina, making sure that the opening is facing the cervix and ensuring also that the cervix is covered. And then another one, this diaphragm is left in the vagina for at least 6 hours after the last time of sexual intercourse. And then the spermicide is reapplied after an hour or every time the couple have sex. That's for spermicides. Next one, we also also have another type of spermicide. So the suppository spermicide. So this can also be used. So hold the film or suppository near the entrance of the vagina. And of course, using the finger, push the product up into the vagina and insert it as far as it will go so that it is positioned near the cervix. And once the suppository or film is inserted, it will need time to melt completely. So this is one of the characteristics of suppository spermicide. So it needs to melt completely. And the couple need to wait at least 10 minutes before engaging in any sexual activity to ensure that the product is thoroughly dissolved or melted. So doing so before the time intended may render the spermicide ineffective at preventing, of course, the pregnancy. And also take note that inserting film or suppository spermicide more than 1 hour or more than 60 minutes before having sex will kill its effectiveness. So that means the spermicide must be inserted up to a maximum of 1 hour before sex. So that's for suppository spermicides. Next, we also have here the coitus interruptus. So this is the withdrawal method. So it's the act of withdrawing a penis during intercourse prior to ejaculation. So um, the purpose of which is that there will be no viable sperm that will be introduced into the vagina. And it is also considered as a natural way of contraception. However, this method has a high rate of fertilization because seminal fluid prior to ejaculation has a chance to come out and may contain a few viable sperm cells that may fertilize the egg. So that means it needs precise timing so that the penis can be withdrawn from the vagina at the right moment. Now let's talk about the moral issues in the use of contraception. So the Philippine government at one time encouraged the use of various types of contraception to solve the persistent problem of overpopulation. However, as what I have mentioned earlier, conservative groups quickly countered that the use of contraception is a direct violation of God's commandment. And from these campaigns sprang two main arguments regarding the morality of contraception. So number one, the arbitrary separation of the generation of new life, and the next one, the arbitrary separation between the unitive and procreative meanings of the conjugal act. Anyway, when we say arbitrary, it is done without concern for what is right or what is fair. So number one, we have the arbitrary frustration of the generation of new life. So this argument holds that the contraception deliberately violates the main goal of sexual intercourse in married individuals, which is the procreation of life. And also, it maintains that man has no right to block the natural design of God once two individuals are joined together. And the stand of Catholic Church is clear when Pope Pius XII, in his discourse on October 29, 1951, acknowledged that the practice of contraception during the sexual act is unacceptable. So that's Pope Pius XII. Next one, we have the arbitrary separation between the unitive and procreative meanings of conjugal act. So it was Pope Paul VI, so that's him, in the papal encyclical entitled Humanae Vitae. So Pope Paul VI emphasized that the normal transmission of life should be observed in conjugal acts. So this argument explains two important points. So we have again the unitive, so that means the affirmation of the mutual love of the husband and wife. And we also have the procreative, so the participation of husband and wife in God's creative power by introducing their offspring. So that's the second one. And also, the moral issues in using contraception are both intrinsic and extrinsic. So intrinsic moral issues about contraception pertain to marriage. So this means that marriage people would rather take contraception as an artificial way of temporarily preventing additional children. However, society dictates that children are blessings from God, and if more children are produced, it would simply mean more blessings from the Almighty God. And based on this intrinsic argument, God provides married couples with more children because they have the capacity to support their offspring. And take note also that Catholics are not consequentialists, meaning to say they do not determine the morality of an act by attempting to foresee all of its consequences. So that's for the intrinsic belief on the moral issues of contraception. And then the extrinsic moral issues of contraception simply indicate issues outside of marriage or those with another married person that is involved in the intrinsic issues. So the individuals would rather practice contraception to conceal embarrassment and dishonor. So that is for extrinsic issues. And we have the question here: is contraception a solution to overpopulation? Because currently the Philippines holds the title of the 12th most populated nation in the world. And with a population estimate of 100 million, the country's economic and health sectors are both having a hard time dealing with the problem of widespread poverty. And also, the experts say that a fertile woman has the capacity to have an average 3 babies in her lifetime. Another issues are on the neighboring countries, so like China, Taiwan, Singapore, also South Korea. They have somewhat halted population growth, resulting in a strong and stable economy. So that's why maybe our government is also telling us that we need to use contraception method to solve the problem of overpopulation that leads to poverty. And then this country, however, Hong Kong, is considered a heavily populated place as well, just like us, but it holds the title of one of Asia's symbols of economic stability. So by these facts, the question now is, do problems in controlling the population reflect the economic state of the country? So until now, it's still a debate. And okay, so let's go now to the norms and values of society versus contraception. So we have here the words morally right and morally good. So morally right, so this norm asks whether or not contraception is the right thing to do in order to control the increasing population. And contraception is the right way for society, according to morally right, if it is accepted by the people at large. And usually, nobody can contradict and comment negatively on what has been accepted and recognized by the society. So that means it is morally right if it is accepted and recognized by the society. How about for morally good? So this is from a woman's point of view based on a set of norms and values. So like for example, for a woman, contraception is a good method of birth control. And nobody can ever question a woman's preference because it is her personal choice to use contraception. And perhaps it is good for her state of wellness, not to have more children, and it is her desire to choose what is best for herself. So that's for morally good. So these are my references. And that ends now my discussion. Thank you so much. I hope you learned something.